New York City schools, they reopen on September 13th. That is less than 2 weeks away. The mayor has, of course, laid out his key plans, including masking all students and staff must also all be vaccinated. There is no testing option available.
Not on the table right now, remote learning. And that's going to be a big topic at tomorrow's education oversight hearing, where council members plan to question the school's chancellor, public health officials. Here to talk about the upcoming hearing, Education Chair Councilman Mark Treyger. So good to see you again, Councilman, twice in 1 week, but it's a busy week. So
yeah, it's good to be with you both.
Let me get right to it, because what is, I guess, the most important question that you want answered at tomorrow's hearing?
Well, first, we have some breaking news that I've learned now that the city's health commissioner will join the chancellor at tomorrow's hearing. So that's significant. Dr. Chokshi will be there to answer questions. What I'll tell you is this. I have more concerns. Initially, my main concern is that we don't even have a vaccine yet for young children, kids under the age of 12. I spoke to a number of high school principals yesterday, and I have even more concerns. A lot of the city's health protocols for our schools center around who is vaccinated, in terms of who gets tested, who has to quarantine. Well, speaking to many principals yesterday, I could tell you that many parents are not aware that they can indicate their child's vaccination status through an online portal. Many folks had no idea about this. And so we're a few weeks away from the start of school. The decision about who gets tested each month, remember, they're supposed to test 10% of unvaccinated students each month, twice a month. We don't know who's vaccinated. We don't know who has to quarantine. So we have even bigger issues and concerns at this hour, which I plan to press at tomorrow morning's hearing as well.
Okay. Right. So, Mark, you obviously have been very vocal in your stance, believing that there should be a remote learning option here. We know that the mayor vehemently opposes that. We just reported less than 2 weeks before the start of this school year. Do you think there's actually time to implement one?
Well, let's look at what's happening in neighboring states or across the country. New Jersey, the governor there had also said everyone has to come back in person. And just very recently, very quietly, the New Jersey Education Department issued guidance to school districts that they can now begin to work on a remote option. I could also tell you that many principals who I've spoken to in New York City are quietly doing the same. They're making sure that their kids have iPads and have technology. The issue that I have is that when children have to quarantine, inevitably there will be cases in our schools. It's already happening in charter schools. The issue is when kids have to quarantine for 7 to 10 days, what will their instruction look like?
Yeah.
Who will be responsible for their instruction? Not every kid has internet at home. So there's concerns of equity here in terms, and also safety.
To be very clear, you're saying that they're working quietly across the state in New Jersey on remote options, but the governor has been very strong and steadfast on that they're not doing it, that they will have in-person learning. Let me ask you this, Councilman, because all teachers must be vaccinated, many children will be, everyone will be masked, right? So a devil's advocate here, the school COVID transmission rate in New York, it's been low. And so is the overall city rate. So why is there such an alarm about in-person learning if the health officials are saying the schools are one of the safest places to be?
Well, Dan, the devil's in the details, and it's very important that we get this clear. Right now, New York City school children are not even required to provide consent forms to get tested. They can't test any random kid. They have to get consent forms from parents. Right now, those consent forms are not required. Also, you're supposed to test unvaccinated students. We don't know who's vaccinated and who's not vaccinated right now. So I would question the city's surveillance system that they have in the school system. We're not getting an accurate picture of what's actually happening in our school system right now.
Mark, we know you have the school's chancellor as well as city health commissioner coming in before your committee tomorrow. Dan just mentioned the science supporting in-person learning. What information do you hope is presented that actually proves your point that there should actually be a plan B for remote learning?
Well, I am following the science. I'm listening very carefully to public health experts who are saying that this Delta variant is far more serious than the original Alpha variant of COVID-19, where it does impact children. We do have a vaccine for kids over the age of 12. We don't have a vaccine for children under the age of 12. I am also hearing anecdotally across pockets of the city that vaccine hesitancy is very real. It's something I'm even battling in my district as well. It's an everyday work. So we have a lot more work to do, but I'm following the science here, and I want to provide families with flexibility and support during these very challenging times.
Understood. And it is such a hot topic and something we're paying very close attention to. You know, we'll be following the hearing tomorrow, Councilman Treyger, and we invite you back after the hearing to kind of talk about what you learned, and hopefully you get some answers tomorrow.
Will do. Thank you. Thanks so much for having me.
Thank you.